Welcome everyone, and thank you for joining us for another webinar session in the Change for Climate Lunchbox series. Our series includes sessions that provide practical tips for action as well as research relevant to our community. Today is the second of 3 sessions where we are featuring the results of research supported by the City of Edmonton's IPCC Legacy Research Grant. Last week, we heard about fire risk modeling in the city, and today we will learn the results of research that explored impacts of weather and air pollution on older adult and immigrant populations in Edmonton. My name is Heather Wheelaker, and I'm here with my colleague, Karen Young. Both of us work in the Planning and Environment Services branch with the city. We're joined by Stephanie Drazda with Alberta Ecotrust Foundation, our partner for the city's IPCC Legacy Research Grant Program. Just a note that this session will be recorded. At this time, I wish to acknowledge that we are on the traditional land of Treaty 6 territory, a welcoming place for people from around the world. We also acknowledge this as the Métis homeland and the home of one of the largest communities of Inuit south of the 60th parallel. We do this to create awareness and to remind ourselves that we are all treaty members, regardless of where we are from or what language we speak. We stand in solidarity with and support Indigenous people and commit to continue our individual and organizational journeys of meaningful reconciliation. It is now my pleasure to welcome Stephanie Drazda from Alberta Ecotrust, who will facilitate our session today. Welcome, Stephanie.
Welcome, everyone. I'm happy to join you all today. I'm a program specialist with Alberta Ecotrust Foundation. My colleague Diana Krapko is also here just to provide backup in case something happens to my internet. And so Alberta Ecotrust Foundation, we've partnered with the City of Edmonton since 2019 to deliver the city's IPCC Legacy Research Grant Program. I'm excited to be joining you today and in our last session in May to share the results of the research from this unique program, which is advancing knowledge about how Edmonton can become an energy sustainable and climate resilient city. It is now my pleasure to introduce today's session speakers. We have Shelby Yamamoto, who is an assistant professor in the School of Public Health at the University of Alberta. Her research lab, Climate Health and Environment and Epidemiology, research, or CHEER, focuses on health aspects related to climate change, air pollution, and psychosocial factors. As an environmental epidemiologist, she is particularly interested in investigating air pollution and climate change exposure, developing and exploring ways to capture climate change and air pollution related vulnerability, and assessing mitigation and adaptive capacity and promoting community resilience. Charlene Nielsen is also joining us today. She's a postdoctoral researcher with Dr. Shelby in the CHEER Research Lab in the School of Public Health at the University of Alberta. She completed her interdisciplinary PhD in Earth and Atmospheric Sciences and Medical Sciences and Pediatrics in 2018 at the University of Alberta. As a geographer, Charlene is dedicated to defending the health of the land by developing spatial data science solutions for planetary health. So it is now my pleasure to turn it over to our presenters, Dr. Yamamoto and Dr. Nielsen.
So thank you for the invitation to be here. It's always a pleasure to share what we're doing in terms of our work and reach out to other people and hear questions and comments and yeah, to make our research better. But before we get started, I would also like to state a land acknowledgement. So Charlene and I are based at the University of Alberta, and the University of Alberta respectfully acknowledges that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous people, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Sultano, and Anishinaabe, Inuit, and many others whose history, languages, and cultures continue to influence our vibrant community. And before I launch into our presentation, I would just like to extend a huge thanks to our very fantastic team. We're highly interdisciplinary, and you can see some of our pictures here. And so feel free to reach out to us later on if you have any questions. I've included my email actually at the beginning of this presentation as well. And also to the whole crew of students that we had working on these projects as well. So thank you to them. So the impetus behind this project was really to learn a little bit more, in a little bit more depth, about how climate change is affecting Edmonton. So we've already seen evidence of climate change affecting Edmonton. We're experiencing some of this as we speak. And we know that in the future, we can expect to start to see, well, we can expect to see an increase, for example, in warmer nights, in hot days, in the frequency of these freezing rain episodes, unfortunately, that have been plaguing us this past winter, as well as the fallout from wildfires. So not only the wildfires within our own province, but also neighboring provinces and also the United States. And so some of you may have been around for some of these really smoky days where the air quality gets very poor and the visibility is very reduced. And so we can expect to see, unfortunately, more of these kinds of events with climate change in Edmonton specifically. So within this project, we actually wanted to delve a little bit deeper to see what the effects are on different segments of our population, is because we know that not everyone within the population is going to be affected or is affected equally by climate change. And so the two populations that we decided to specifically focus on for this project were our older adult populations and our immigrant populations. And there were a few reasons for looking at these particular populations. So for our older adults, we know that many of our older adults have existing conditions that can actually increase their risk from climate change events and subsequently experience cardiovascular, respiratory, or injury or mental health events. There can also be social aspects that may increase their risk as well. So for example, seniors that live alone could be at increased risk during heat events from these health effects that we were looking at. And in terms of our immigrant populations, this actually represents a segment of our population that hasn't been extensively studied, not just in Edmonton or even Alberta or even across Canada. And so some of the reasons for studying this population are because of evidence that we have to suggest that there could be barriers that are facing this population when they come to Canada or when they settle in Edmonton. So for example, language barriers or access to or awareness of services or organizations that can help to support communities during these weather events or during air pollution events. So again, there are a few different reasons why we decided to focus in on these two populations. We do hope to expand in the future into other populations, such as our homeless populations and children, among others, whom we know that are disproportionately affected by climate change as well. Okay, so the health impacts that we looked at were quite varied because, unfortunately, climate change and air pollution are linked to a number of different health impacts. So we broadly grouped these into 4 different categories. We were looking at respiratory conditions, heart problems or cardiovascular conditions. Mental health was an interesting one because we have a lot of research that is now emerging suggesting that there is this link between weather, climate change, air pollution, and mental health. And so as an example of this could be the displacement that occurs during flooding events or during disasters that may lead to mental health impacts. And of course, falls and fractures. And within that, the larger umbrella of the injuries when it comes to health impacts. So for example, during these freeze-thaw cycles that we get, walking on ice and falling, and especially for our older adults, fracturing hips and things like that was one thing that we actually wanted to study. So we actually have 2 different approaches that we used to investigate these relationships within Edmonton. And so the first was actually just to go out and have conversations with our communities. And specifically, most of our conversations took place with our older adult communities, but within those groups, we also had older adult immigrant communities as well. We do hope in future research to be able to have more conversations with other immigrant communities as well to round out sort of our knowledge in this area. But the findings actually to emerge from this part of our work are actually quite interesting. So in our conversations with our older adults, there were 3 different themes that sort of emerged from this work. So the first is this idea of making sense of climate change. And so older adults who participated in our conversations expressed awareness and concern about the climate change crisis. Older adults actually obtained their information from media, from politics, and from social spheres. And they were very much aware of and concerned about and the need for climate action. And so those that were actually concerned, some of those that were actually concerned actually expressed sort of being overwhelmed by the enormity of the climate crisis. And this is something that I can relate to and something that I've also heard from other groups as well. So again, there was this definite awareness of climate change and this need to, and this awareness of the need to address climate change but it wasn't always clear about how this could be accomplished. And so, and there were some variations in terms of perceptions of risk within this population. And especially when it came to personal risk, some individuals, for example, didn't necessarily consider themselves at risk or weren't necessarily worried about themselves, but were more worried about future generations, such as their grandchildren. The second theme to emerge from this was a statement or a perception of a lack of leadership in managing climate change. And so participants really highlighted the need for more government accountability in this space and to really take into account local and global inequities when it came to issues around the climate crisis. And and some of the participants actually also, the conversations arose skepticism about government-initiated policies and actions, and this need to sort of build this trust between government and also the public. And so the third theme to arise out of these conversations was the actions to address climate change. And so a lot of our seniors recognized that taking action was important, and they felt a personal responsibility and wanted to do something about it. But they also expressed barriers in some cases that seemed almost overwhelming in some cases when it came to being involved in this space or in this sphere or in this conversation, really. And some of these barriers included like just not even being involved in conversations, not even being invited to have a seat at the table. Climate literacy knowledge gaps, as an example, or having appropriate literature that are specifically targeted to these groups was another barrier that was identified. And lack of concrete guidance specifically for individual actions and appropriate actions specifically for this group were other points that were raised in our conversations with our older adults and our immigrant communities. Okay, so the second part of this was actually looking at the quantitative relationships between our exposures and the different classifications of the disease that I had talked about. So not surprisingly, we did find that air pollution was a risk factor for cardiovascular injury, mental health, and respiratory conditions. We also had some evidence of relationships with injuries for heat events and for temperature, and also for respiratory conditions. So we have some emerging evidence that we'd like to delve into a little bit more detail that are emerging from these results. And specifically when we were looking at community level factors, what we observed is that a higher proportion, as an example, of our older adults, defined as those over the age of 65, were associated with all four of these health events, unfortunately. And specifically for injuries and respiratory conditions, we also found that an increased proportion of refugees also within our communities was also linked to these health events and increased the risk of these health events. And relatedly, not surprisingly as well, we found that social deprivation and material deprivation was also clearly linked to many of these different health outcomes as well. So they increased the risk of these health outcomes. But on a more positive note, we actually observed that there were factors that seemed to be protective or lower the risk of these events. So for example, the proportion of greenness. So if you happen to live in a neighborhood that has a lot of green space, this seemed to be protective for things like cardiovascular events and reduce the risk of cardiovascular events. And the same thing with active living environments. So if you lived in a more favorable active living environment, which is defined as walkability in your neighborhood is one of the components. So can you walk to different features within your communities? Do you have sufficient public transportation? So these kinds of favorable active living environments were actually associated with a lower risk of, for example, injury and also respiratory events. So again, this is all interesting sort of preliminary results that we have that we would like to explore further. And this is definitely something that we'd like to delve into at the individual level, because all of this is at the community level. We were looking at dissemination areas, which Dr. Nielsen is going to get into a little bit later. So one of the main conclusions that we drew from this work is that negative community health effects of some weather and air pollution hazards were found to be greater in areas where we happened to have higher percentages of older adults and immigrants or refugees. And so, but we don't know what that relationship looks like, if it's just a co-occurrence of these things or if one precedes the other. And we're really looking forward to exploring this in a little bit more detail. So those are the results that we have from sort of the research part of it. And so we actually wanted to see if there was a way that we could actually translate this information into a useful tool that could be used by different stakeholders, including the city of Edmonton and other people who were interested. And so this is where we had the idea of developing maps. And so we combined all this information into an index, which Dr. Nielsen is going to get into quite a bit more when I pass over to her. But again, we developed these maps, and she's going to give you a live demo of what these maps look like. So maybe what I'll do is I'll hand it over to you, Dr. Nielsen. Thank you.
Okay, so before I actually do a demonstration of the maps, let's take a look at the Intergovernmental Panel on Climate Change, or IPCC framework, that we use to guide the development of the index. And it starts with vulnerability. So this is defined as the predisposition to adverse effects. And in our changing climate, older adults and immigrant communities, among others, of course, but we can only focus on a couple for this initial project here, they may face greater vulnerability. And so our goal was to build an index based on the dimensions of exposure, which is contact through air, water, skin, or ingestion that can affect populations. The sensitivity, the characteristics that can increase risk of experiencing the exposure-related adverse outcome, and adaptive capacity, so the ability to adjust to potential damage, to take advantage of opportunities, or to respond to the consequences of these different exposures. And each dimension consists of multiple environmental indicators. And we examined hundreds of potential indicators, and the table that Shelby just summarized earlier was a handful of those. They're all from publicly available data sources on the built, social, and natural environments. And we use GIS software to customize the spatial database using the dissemination area as the common geographic link. And for those of you who aren't familiar, the dissemination area is a standard census geography unit that the results of the census are made available to us. And so we selected these final indicators of the index based on expert opinion, so known relationships in the scientific literature and input from some stakeholder engagement. And we had done a previous scoping review or a literature review on the different types of extreme weather events and air pollution that are associated with health impacts. And we also performed some regression analyses, as you saw the results from traditional epidemiology using biostatistical models. We also did some spatial temporal modeling. And so this is where the indicators were explored as predictor variables for the health outcomes that are susceptible to the climate-related events and air pollution. And so not going to go through all the details of that. We're just going to show you how we compiled the results from those different selection methods. And this first table lists the 15 indicators for the sensitivity dimension. So they included things like deprivation, the proportion of older adults, low income, immigrant status, and language. And note that the population-related variables were adjusted or geographically weighted by dividing the population per square kilometer of each dissemination area. And then we use the inverse of some of the variables to reflect the appropriate directionality. So for example, where it has single detached homes, we use the inverse. So basically areas that had fewer single detached homes, or English as the mother tongue, areas where there was less English spoken as the main language. And to combine all of these indicators that we selected, we used an unsupervised machine learning technique called principal component analysis. And what it does is it just reduces the dimensionality of all these indicators into one basically number to give us the relative overall amount of sensitivity. And the 12 indicators for the exposure dimension included industrial emissions, land use regression models for criteria air contaminants, which is just a fancy way of modeling monitored air pollution across the whole landscape, as well as meteorological variables like temperature and precipitation. And again, we applied that principal components analysis to combine all the indicators into one value for the exposure dimension. And each value is at the dissemination areas across the city. And for adaptive capacity, the 7 indicators included things like the active living index. So basically the amount of walkability in an area, amount of vegetation, and access to services and healthcare. Again, we applied the principal component analysis to get one adaptive capacity dimension. And so the standard formula is to add sensitivity and exposure together with the inverse or subtracting the adaptive capacity. However, this can result where we have areas of equal value where there may be very different sets of indicators. So for example, you can have really low sensitivity and high exposure and a medium amount of adaptive capacity. And if you have that reverse, so high sensitivity and low exposure with the same amount of adaptive capacity, those two areas in the city could have very similar values. So rather than just doing the straight simple math, we applied another type of machine learning technique called multivariate clustering. And so what it does is it looks at those values, and the fancy graph on the right-hand side here is called a standardized box plot, where each of the gray shaded areas shows the range of values for each dimension. And then the colored lines connect where those different values occur in that particular cluster or grouping of those 3 dimensions. So the yellow cluster is where we have high sensitivity, low exposure, and low adaptive capacity. The brown clusters are where we have medium sensitivity, low exposure, and medium adaptive capacity. And the green clusters are where we're going to have low sensitivity, medium exposure, and high adaptive capacity. And because these clusters identify where we have relative amounts of sensitivity, exposure, and adaptive capacity, we can visualize them on a map. And then we'll know which areas will benefit from a corresponding reduction or increase in the relevant indicators that contribute to that dimension of interest. So for example, we look on a map and see all the areas with the yellow cluster. That shows where we need to increase adaptive capacity. And so understanding the climate change vulnerability is important in helping to adapt and mitigate risks. And so, like we promised, we've shared the results in a community-focused interactive web map using ArcGIS Online and Story Maps, which is a readily available web-based platform. And so this can be used to inform the public and planners and policymakers on which extreme weather and air pollution events threaten the health and well-being of older adults and immigrants, and identify areas where the impact may be higher and where action may be required. And so I'm going to switch screens here. I'm going to go to our website, which has links to a technical report, a user manual, and an interactive story map. And okay, so if you click on projects, of course, click on all the other tabs and you can see what we're all about. And scroll down to the building community climate change knowledge and resilience in older adult and immigrant populations. And you can learn more, and you can read all about the objectives and basically a little bit more information, the overview that Shelby just gave you. There's a link to the story map, maps, and reports and things like that. I'm going to go directly to our map tool right now. So the first thing that comes up is an interactive map. And if you've ever been on Google Maps or Bing Maps, when you're searching for where to go to your cousin's house or the local restaurant or something like that, basically you can just zoom in and out. You can click and drag and move around on the interface of the map. Over on the left-hand side, we have a couple different pictures, which are basically kind of tabs. If you click on the eye, the circle with the eye, that's an about, and it tells you right away that this vulnerability index is represented as 3 clusters based on the combinations of those dimensions. And so the yellow is where we have high sensitivity, high exposure, and low adaptive capacity. And so wherever we see yellow areas on the map, we can actually even click on one, and we can see that we have relatively high values of sensitivity. It doesn't really look like a high value of exposure with negative, but I keep in mind these are all relative. And then the adaptive capacity. And so we can click on another area. You can click on your own neighborhood if you want, and we can see where we have high sensitivity, exposure, adaptive capacity. And same thing with a green area. We can click on one of those, and we see that we have relatively lower amounts of sensitivity and medium amounts of exposure and high relative number of adaptive capacity. And there's also quick links to the user manual and technical report, which are also again on our website. And we'll click back here on the layer list. And this is just a scrollable list, basically a legend or a table of contents showing the legend of what we see on the maps. And you can easily just turn them on and off and see the individual dimensions. So if you want to focus more on the sensitivity dimension, we could zoom in, maybe we'll look around the university, and it's actually no values. Unfortunately, due to some of the data that went into building the index, if people don't live there, there's no population. So some of those values didn't get carried over into the full map. But I'm not going to pick on where anybody lives here, because that's an invasion of privacy. But you can look at your own place of residence, or where you have kids that go to school, or where you might have relatives who live in maybe seniors complexes or a neighborhood that you're thinking of moving to. And of course, we also have the exposure dimension. And so there's different parts of the city that have different relative amounts of exposure and adaptive capacity. And in all 3 of these dimensions, the darker the color or shading indicates a higher relative value. The lower the color or shading, or the lighter, means a lower value. And you can see the different shaped polygon areas. Those correspond to those dissemination areas, that census geography I mentioned. But if you want to know the exact neighborhoods, there is an overlay where you can just click on there. And so if you wanted to see, for example, the Inglewood neighborhood, you can just click on that and see whether or not you're looking at the neighborhood of interest. So this is meant to be interactive and to provide as much information as we can without too much technical jargon or too much complication. And so it's basically just the simplest message of where we have these yellow clusters where we may need to increase adaptive capacity, or look at these green areas where we do have higher adaptive capacity. And so maybe we should look at the different indicators and characteristics of those neighborhoods so we can apply them elsewhere in the city. So that's about all I have to say about that. I'm going to pass this over to Shelby now, who will wrap this up.
So I always like to end on a note of hope so that people don't go away despairing about climate change. And so the last thing I want people to take away from this talk is that climate change is a foregone conclusion. That's not true. There's a lot of work being done by a lot of good people. And recommendations to come out of our work specifically are that there are initiatives that can be undertaken specifically at the community level that can potentially make a difference in terms of climate change. And of course, we have initiatives that go all the way up to the federal level, which we didn't study in this work. But as an example of a community initiative is, I just want to give a shout out to the Tomorrow Foundation, which is a nonprofit foundation. And they have an initiative where they're looking at developing a carbon negative or a net zero backyard house. And so please check out their website for more information on that, specifically in Edmonton. So again, because some of our work showed the importance of things like a greenness and active living environments, another recommendation was that promoting sort of existing new infrastructure, developing new infrastructure and existing infrastructure around these areas could be potentially a way to adapt to or even mitigate the risks from climate change on health. And lastly, of course, one of our strongest recommendations is to involve these communities and groups that are working with these communities in conversations about climate change. So we see evidence that some of these groups have been traditionally left out of these conversations, and they do want to be involved. And so as we move forward with developing a more appropriate and more targeted adaptation or mitigation strategies, involving these groups in conversations is going to be extremely helpful, and it's also going to be necessary for us to undertake these endeavors. So with that, I would like to end our presentation, but first of all, I'd just like to extend a huge thank you to our participants and everyone who contributed to this research, as well as our funders, who include Alberta Ecotrust, the City of Edmonton, and the Commission for Environmental Cooperation. So thank you very much.
All right, so thank you so much, Dr. Yamamoto and Dr. Nielsen. Really important work and really fascinating results. I'm excited to dive into that map and take a closer look myself. Karen will just add the link to your website as well as that story map for folks. Just one last time in case folks wanted to take a look. And we do have some questions that have come in. One question was about looking at the effects of climate change and air pollution on people with disabilities of all ages. I guess, is that a demographic you've considered looking at?
Yes, and so for this project, we started a bit small so that it could be manageable, it could be bite-sized. And in our explorations, we do, as I had mentioned, we do hope to expand to other populations. We're not necessarily going to be able to get to all of them at once, but this population again is another one that we are definitely looking at, and so we're always looking for connections and organizations who work with these populations as well. So yeah, happy to have that suggestion and looking forward to future research that expands on these groups.
Great. Another question, are the weather conditions analyzed as a single unit for the whole city, or are there meteorological stations within the city? If so, where is this used?
I'm going to pass that one over to Charlene, if you don't mind, because she's the geographer.
Yeah, so no, we do not actually have the weather conditions as one blanket value for the whole city. And some of you may already know that we have maybe 3 or 4 actual weather stations for the city. We drew on the weather stations outside of the city, as well as pulling in data from other sources. So CANUE, C-A-N-U-E, the Canadian Urban Environmental Research Consortium, they provide urban level data for all across Canada. And they have all these wonderful weather metrics, meteorological metrics, that they have interpolated from, or basically created spatial predictions from where we have the single stations throughout the city. And so it gets modeled across the city, and it's not just one value for the whole city. So
I guess
the long answer.
And in follow up to that, they were asking also about air quality, is where that data is from.
Okay, and that is also, we ended up using from the CANU website as well. We had done our own modeling of it, but without having access to more than just the 3 or 4, because there's only about 3 or 4 air quality monitors that are active throughout the city. We don't get the finer spatial resolution across the city. And so there are other people who have more time and they've previously done this work, and they've created what are called land use regression models, which again takes the measured values from the monitoring stations and looks at predictor variables across the landscape, such as road density and the type of land use. So obviously where you have residential land use versus more commercial or industrial land use, there's going to be very different types of air quality. And so it looks at that, as well as measurements from satellite remote sensing. So it takes satellite imagery and looks at what's in the atmosphere. So it can actually measure like particulate matter and things like that. And so it's a lot more sophisticated, and it models across the whole city for the air pollution. So we do get local variation. So parts of the city do have higher air quality issues versus other parts.
Great, thank you. So the next question, does the map have capacity to map seniors housing, for example, the Greater Edmonton Foundation, lodges, etc., as an overlay to contextualize older adult population risk and possibly refugee or new immigrant overlays?
And that's a wonderful question. I love that. So we actually need to make our map available so people can bring our map as an overlay into their own mapping software, and they can bring in whatever other contextual variables or data that they want. We could add some of these different types of things, like where we have senior centers or basically the original indicators that went into, for example, the sensitivity dimension, the proportion of older adults or the proportion of immigrants, that could be brought in as an overlay. And we do actually have another set of maps that look at the indicators, but we haven't made those publicly available. Some of the data is subject to data sharing agreement, but most of it is supposed to be, something happened to my camera. You can still hear me, right?
Yes.
Yeah, we can still hear you.
I think that answers it.
Yeah.
Okay.
Great. Thanks. So the next question, how did you measure community level mental health? And I think there's a comment that sort of relates to this. For example, I hear some medications for folks with mental health challenges like schizophrenia are negatively affected by the heat.
Yeah, that's another great question. So first of all, thank you for the suggestion to connect with the West End Seniors Activity Center. We have actually, and we're hoping to develop some new research programs with them. So we're looking forward to that partnership. Yeah, regarding the mental health. And so as with any of the other conditions, we had data that we obtained from Alberta Health Services that were aggregated to these dissemination areas that Dr. Nielsen was talking about. And so basically what we were looking at is the proportion of these events within any given dissemination area. And that's how we were estimating these sort of community level mental health events, if you will. And so I hope that answers your question. And regarding the medications and schizophrenia, and actually just even broadening it up to medications in general, we do recognize that taking medications and other conditions can also contribute to increased risk in these populations as well. And so with future work going forward, we are hoping to tap into that database, again, also from Alberta Health Services, that will allow us to pull out that information, include this as another variable in our analyses and also in our maps to see if it actually does make a difference in terms of risk or in terms of risk in these populations as well. So thank you.
Right. So the next question, and perhaps you covered this, but were the parameters, so sorry, this is regarding sensitivity and exposure parameters, were they selected based on the observed impact on physical, mental, social impacts, or were they selected based on assumed impacts?
So they were based on previous research and existing knowledge and sort of what we have a priori knowledge of. So a lot of this was based on previous research, as an example. So the thing is, when we dove into the literature, we looked at papers and we looked at research that had already looked at these linkages. And so the thing is, there was some evidence of this connection between these different exposures and these different health outcomes. And so, like Dr. Nielsen was mentioning, we use sort of a combination of approaches to identify like the variables that we would put into the sensitivity dimension, the exposure dimension, and also the adaptive capacity. And that included, going back to the literature, experts' opinion, and also using a statistical analysis as well. So it was kind of a combined approach.
Great. And I think I'm just going to skip ahead a little because this other question relates to that. Why would sensitivity and exposure be added and not multiplied? For example, high sensitivity but near zero exposure might have near zero impact if multiplied. Similarly, for high exposure and near no sensitivity might have low impact.
Charlene, did you want to tackle that one, or did you want to throw that one over?
Yes, I can answer that, no problem. So the IPCC framework is just a guideline. So you can add the dimensions and subtract adaptive capacity. You can even multiply and divide if you want to do that. We ended up going the approach of machine learning, where we did the multivariate clustering, because that gets us away from, we can have very different results if we add versus multiply. Whereas with the multivariate clustering, it looks at basically the distribution of the data relative to each other. And so then we can get these clusters that are a little bit more meaningful, that tell us where we have relatively higher amounts in the different dimensions. So for example, what we call the yellow cluster, it could be given a better name than just the color, but because it's the color on the map, it's very intuitive. Where we see higher sensitivity or low sensitivity, high sensitivity, high exposure, and low adaptive capacity. That is a lot more meaningful than just say one single number that we would get if we added or multiplied. But yeah, that's a very good point that audience member brought up. And we explored some of that, but ended up deciding that the machine learning approach that kept the relative amounts of the different dimensions was ultimately a lot more meaningful, because you could actually take action on those.
Great. So the next question, if you can answer this, it's a bigger question. What pressure points would you like to see civil society pushing on to get faster policy advances to mitigate risks?
Well, that's a big one. And
do we dream?
Yeah, so me personally, I would like to see sort of faster action on this, involvement, and more people sitting around the table, because specifically related to this research, there are not enough people in representation from these organizations and from these populations in being involved in our conversations about climate change and adaptation and mitigation. And so, and especially because we know that the population of Edmonton is really heterogeneous, and to get people involved requires sort of throwing open the doors, I feel. And yeah, I would like to see faster action happening on this. I mean, we did, I believe it was 2019 that Edmonton declared a climate emergency. And so I would really like to see us treat it as such, right? And as an example, I know that we can move forward quicker on some of these initiatives, because we've seen it with the pandemic. So people coming together, scientists, policymakers, stakeholders, coming together to tackle a really large global problem. And so this is something I think that lessons learned that we can also apply to the climate crisis as well. And so, but more at in Edmonton or municipal level, again, really fostering those community level sort of initiatives as well. Maybe having some sort of place where these could be listed, and fostering those collaborations between municipal bodies and also these community organizations, and promoting events like this, I think are going to go a long way in terms of highlighting this issue and sort of keeping it on the forefront of agendas of policymakers. So that's kind of a far-ranging question here. I don't know if that's what you're looking for.
All right. I think this is the last question. If there's any other final thoughts, folks can please add them into the Q&A. But to end us off, has the City of Edmonton engineering section been consulted to assist in improving adaptive capability?
So we have reached out to the City of Edmonton engineering section. We do have started some collaborations with one of the members there, and they have been involved in some of our earlier work. I know that those folks are really busy, but we do look forward to sort of picking their brain and tapping into their expertise much more now that this research is wrapping up, and we're embarking on other research that will extend this to the rest of the province and help us delve into these questions in a little bit more detail. So for sure, we're going to be reaching out to a lot of different partners in the next phase, because the one thing that this research highlighted is the importance of sort of getting perspectives and reaching out and having expertise involved in many different corners if we want to move this research forward. And so thank you for Anna's comments about refugee settlement housing data and new immigrant housing data as well. I think, yeah, like Charlene was saying, we are using publicly available data sets, and that was a deliberate, conscious choice, because we wanted this to be something that could be accessible and updated on a regular basis, and didn't necessarily rely on resources that were only accessible, for example, to academics or people in the university system, so that it would be a useful tool that could be updated on a regular basis and used. And yeah, so one of the things that we did notice, actually, or did note, that when we're looking at immigrant population as a whole, the thing is, it's a very diverse group in and of itself. So, I mean, leave alone the population of Edmonton, when we're looking at immigrants as a group, we have economic immigrants, sponsored immigrants, we have refugees, and we did notice variations in terms of risks across those groups as well, which we didn't actually really get a chance to get into in this presentation, but it's in our report as well.
So it looks like we have one other one that has come in. Is it possible to correlate the regional parameters with the regional impacts, such as the rates of illness, disease, hospitalization due to the physical, mental, and social impacts?
Yeah, so this is one of the first steps that we did in actually building this index, is because we wanted to be able to relate these different indicators and these different factors to the health events themselves. And so going forward, what we'd really like to do is be able to combine these in such a way that we can talk about sort of layering on of the different risks. So not only in terms of the general population, that air pollution is leading to increased risks, for example, of cardiovascular disease, but what does that look like for an older adult woman from an immigrant community? And so the thing is, like, we're really hoping with our next step to be able to get to that level of detail. I don't know if it's going to be possible with the existing data sets that we have, but that is something that we're definitely aiming for.
Thanks again for the really great questions. And we'll just wrap up. I think, Heather, we'll jump back in.
So we hope that today's webinar has inspired you to learn more, and I'm really thrilled that we were able to showcase this important research as part of our Change for Climate Lunchbox series. So thank you to our presenters, and thank you, Stephanie Drazda and the Alberta Ecotrust Foundation, for co-presenting this session.
Thanks, Heather. And big thanks again to Shelby and Charlene for taking the time to share your research and insights with us today. We really appreciate your time today. And thank you to Heather and Karen for co-hosting the series with us. And last but definitely not least, we wanted to thank all of you, our audience, for spending this time with us today and asking very thoughtful and engaging questions. So with that, we'll wish everyone a terrific afternoon, and we hope to see you at a future session. Take care.